Hello? Anybody there? Hello, is anybody on?
Hello.
Hi, welcome.
Hi.
We'll be starting in a couple of minutes. We start at 7, so about 5 minutes. It's very early morning in Kenya, isn't it? Anybody from Kenya have their speaker off on? Like almost 2 o'clock in the morning.
Yeah, so I'm here. Actually, it's 1:56 a.m. in the morning.
You guys are dedicated. Holy smokes. Welcome. 7 o'clock in Ohio. Hello, Ohio. We're going to get started very soon. Just a couple minutes. I'm going to wait a couple more minutes just in case anybody else wants to log on, okay? Oh, 2 o'clock in Kenya. Oh my gosh.
Okay, all right.
Hello. Well, extra kudos to anybody from Kenya because it's 2 o'clock in the morning.
Yes, I can hear you.
Oh, good, good. Welcome.
Thank you.
I hope you all are drinking extra coffee where it's 2 o'clock in the morning, probably even 7.
I will. Okay.
We'll be starting in just a couple minutes.
Okay, no problem. I'll be waiting.
All right, it's 7 o'clock. Welcome, everybody. Everybody hear me okay?
Yes.
All right, great. Everybody, anybody else? Okay, good, good. Well, welcome, everybody. My name is Terese. I'll be your instructor today. I have many years of experience in many different areas of nursing. I did my education the long way. I got my associate's degree first, and then I went back a couple years later for a bachelor's degree. And then a few years after that, I went and got my master's degree. After I perfected the craft for a little bit longer, I decided I want to go get my master's. So, welcome again, everybody. Tell me where you're all from. I've already seen a couple of messages come through: Ohio, Florida, Kenya. Anywhere else that I'm missing? Canada? And go ahead and put any messages in the chat. Yes, it's cold in Kenya. All right, let's see. Where else are we from? Lucy from Kenya. Houston, New York, Texas, Nashville. Woohoo, Nashville, one of my favorite places. New York, Baltimore. Hello from Canada, Virginia, and Florida. Awesome. You guys have great weather, I suspect. All right, and Ghana. Okay, well, let's go ahead and get started. We have a packed session, so I just want to welcome everybody. Thank you for joining. Thank you for sharing where everybody's from. You guys ready?
Yes.
Great. If you can't hear me, I'm talking too soft, or if sounds like I'm yelling, please shoot me a message and let me know, so that I can alter things so that it's comfortable for everybody. All right, we're going to do a review on fluids and electrolytes with an NCLEX exam review and some strategies. We're going to talk about essential key concepts for nursing and for exam success. This brief review of basic key concepts on fluid and electrolytes, and I'm keeping it just to essential key concepts because you've all graduated. Congratulations. You come to me with a wealth of knowledge already. You are about to embark on a marvelous profession. The great thing about nursing is the options are limitless. Once you have a solid foundation, you can virtually do anything. We are also going to discuss some NCLEX review questions, which I'm sure you're all really excited about, and some strategies to help guide you to success when taking your NCLEX exam. This presentation aims to provide a thorough understanding of fluids and electrolytes. Like I said, mostly key concepts because you've already graduated, so you have a lot of the basic foundation. Essential for nursing practice and NCLEX exam presentation. We will cover key concepts related to body fluid compartments, third spacing, fluid balance, electrolyte imbalances, and effective test-taking strategies. And of course, some practice questions. How we doing? Am I talking too fast? Talking too loud? So far, so good? All right, here's our
It's okay.
agenda. It's okay? All right.
Yes.
Thank you for responding. Our agenda for the discussion today is body fluid compartments, third spacing, fluid intake and output, fluid volume deficit and excess, electrolyte imbalances, NCLEX test-taking strategies, and understanding distractors in test questions. Tell me, what subject would you like to see the least of on your exam? Go ahead and send me a message in the chat. And what would you like to see the most of on your exam? Go ahead and send me a couple messages. While you guys do that, I want to share, I took boards a long time ago. It was with pen and paper, it was so long ago. And it took 2 to 3 days, and it was in a prison-like environment. They literally escorted you to the bathroom. You'll remember that day forever. I remember I was getting a perm at a salon when my test results came in nearly 6 weeks after I took my exam. You're all going to get your test results a whole lot sooner. It's a memorable journey. I encourage you to embrace it, even the challenging parts. You can do this. All right, let's see what some of those chat responses were. Pleasure to have you here, Betty. London, welcome, London. All right, let's see what else we have here. Good, you can hear me clear. OB, all right. OB the least and mental health the most. I would have been totally opposite of that. Great. Least EKG or cardiac, I'm going to guess, and most pharmacology. Okay, good for you. Pharm and mental health, maternal, mental health. What was that last one? Oh, the least pharmacology. Yeah, that can be a lot, especially in the beginning. There's so much to learn. I would like to see less of critical care and love to see ABGs. Well, good. Then I'm going to tap into you when we get to that one because that would be my least for sure. Acid-base balance, definitely not my favorite. Growth and development would be the least. Cardiovascular, psychiatry and maternity. I'm not sure if that was a least or a most. We have a lot of mental health, a lot of pharmacology showing up in here. We do have some classes on pharmacology, so hopefully you guys can partake in some of those. All right, let's move on. Thank you for sharing your answers, everyone. Okay. What are the two body compartments of the fluid? What are they composed of? Send me some responses in the chat whenever you feel like you want to. Understanding body fluid compartments is fundamental for assessing fluid status. The body is composed of intracellular fluid and extracellular fluid, each playing vital roles in physiological functions. Intracellular fluid is the fluid contained within the cells, pretty basic, making up about 2/3 of the total body water. That is approximately 25 liters. That's like 12.5 2-liter bottles of fluid, if you can imagine that. That's a lot of water. It's crucial for cellular metabolism and maintaining cellular structure. Potassium ions are concentrated in the ICF, or the intercellular fluid. You may see ICF as an abbreviation. It means intracellular fluid. Just want to make sure that you're aware of that if you happen to come across that. One thing I want to mention throughout the presentation, I will say, hey, this is important. File it in your filing bank or put it up here because you're going to see it again. It means it's important, and you're probably not only going to see it on your test, but throughout your career. So the definition of intracellular fluid, it's comprised of 2/3 of the body's water, about 25 liters. Its importance is that it plays a vital role in cellular metabolism, supporting biochemical reactions essential for cell function. Maintaining cell structure. ICF is crucial for maintaining cell structure, contributing to cell shape and integrity. Potassium ions are concentrated here in the ICF. That's one of those things we're going to want to file away in the bank because you're going to need that eventually. The sodium potassium pump are concentrated here in the ICF. The sodium potassium pump and the ATP help keep the ions regulated, and hydrostatic pressure govern the water movement. All right, let's keep going. Extracellular fluid. Extracellular fluid includes all the fluids outside of the cells, comprising interstitial fluid and plasma. It accounts for the remaining 1/3 of the total body water and is essential for transporting nutrients and waste products. Sodium ions are concentrated in the ECF. I'm going to say that again. Sodium ions are concentrated in the ECF. ECF comprises 1/3 of the total body water composition. Another two things you can file in your file bank. If you notice on my slides, some things I put in this funny green color. Those are the things that I think you should file away because they're going to come back to you and they're very important to remember, even early on in your practice. Distribution and functions. Fluid compartments. Understanding the distribution of fluids between intercellular fluids and extracellular fluids is essential for maintaining homeostasis. It manages blood pressure maintenance. It plays a critical role in maintaining blood pressure, vital for ensuring adequate blood flow to organs. It's important for nutrient transport. Proper distribution of fluids is necessary for nutrient transport through body and supporting overall health and energy levels. Waste elimination. Fluid compartments assist in the elimination of waste products. This is crucial for maintaining good health. This offers just a brief review of these key points. Do we remember which ions are prominent in the ICF and the ECF? You can go ahead and shoot me a message in the chat if you remember. Third spacing. Third spacing refers to the abnormal accumulation of fluid in non-functional spaces within the body. Understanding its mechanisms and implications is important for effective patient management. I do want to just throw one thing out there about third spacing. It's really not a technical term. I do believe it's actually nurses who came up with that term when they were trying to describe a patient and what they thought they were seeing. So you may hear that. Third spacing, I changed my slide. Third spacing occurs when fluid shifts from the vascular space into the interstitial or transcellular spaces, often due to conditions such as sepsis, trauma, and surgery. This can lead to edema and decreased circulating volume. Understanding third spacing. Third spacing refers to the movement of fluid from vascular spaces to interstitial or transcellular compartments. It disrupts the normal fluid balance, such as IV fluid shifting out of circulation and into the space between the cells and the organs and tissues. This is where you see edema. There are two phases. Phase 1 is where fluid shifts to the interstitial spaces. Phase 2 is the reabsorption phase. Usually patients have symptoms of increased output and weight loss. The consequences of fluid shift can result in edema and decreased circulating volume. Causes and risk factors. Common causes of third spacing include inflammation, hypoalbuminemia, and increased capillary permeability. Risk factors may involve post-operative states and heart failure. That's a big one. And certain medications. Again, common causes of third spacing can be inflammation, low protein levels, increased permeability of blood vessels, heart failure in green here because it's really important. Heart failure is a significant risk factor for third spacing as it affects fluid balance in the body. Other causes of third spacing are conditions like sepsis, trauma, infection, radiation, pancreatitis, plasma protein abnormalities, lymphatic blockages, and surgery, especially post-op, can trigger third spacing. I want to make a really good point about that. When you have a patient who's had surgery and they're post-operative, one of the biggest risks can be third spacing. You see that a lot with post-op patients. So that's one of those things I want you to think about and file away. Clinical manifestations and management. Third spacing leads to clinical symptoms such as edema in the extremities, significant weight gain, output changes, drop in blood pressure, dehydration, and electrolyte imbalances. Fluid management. Effective management of third spacing includes restoring the balance by giving IV fluids and diuretics and other medications, as well as treating the underlying cause. A lot of times there is an underlying cause. Electrolyte monitoring is also extremely important here. Monitoring the electrolyte balance is crucial to prevent complications. All right, how's the pace? Am I going too slow? Going too fast? Let's check our chat. Okay, let's see, make sure we're doing okay here. Yep, you guys got that right. Potassium, sodium chloride, good job. Those are extremely important to remember. Those will come back to haunt you. I mean that in a good way. All right. You ready for another question? When do you change your answers on your NCLEX exam? Go ahead, hit me with some answers in the chat. I'm going to give you a couple seconds to respond to that one. Don't change and never, never. That's right. So when do you change your answers on your NCLEX exam? There's only one time you change your answers, and that's when you are 100% sure what you're changing to is correct. Don't overthink your answers. Mistakes happen when we overthink it. Has this ever happened to you guys? I know it happened to me. Where you changed your answer from the first thing and what you had was correct. Always go with your gut. If your gut told you to pick it in the first place and you cannot prove to yourself that you are 100% right, that the answer you want to change it to is right, don't change it. Does anyone want to share some examples of what happened? We learn from each other, remember? That's right. Stick to your first instinct, Alfred. Excellent. But if not sure, don't change completely unless I click on the wrong answer, certainly. That's right. Absolutely. That's another time you change it. If you click the wrong answer, you can certainly go ahead and change it because you're 100% right. The new one you're picking is correct. Okay. Good job, guys and girls. Monitoring fluid intake and output is crucial for maintaining fluid balance. Understanding sources and methods of fluid management to help prevent complications. Sources of fluid intake. Fluid intake comes from various sources, including oral fluids, IV fluids, enteral feedings, food, and metabolic processes. It is essential for you to understand these sources and accurately assess hydration status. The key to accuracy is also the key to accurately document. When you are practicing and you're delegating tasks like emptying Foleys, emptying trays, removing trays from rooms, make sure that you verify the skills and the understanding and accuracy of your ancillary staff care team to keep your patients in good care. I know some of this seems very basic and obvious, but it's incredibly important not to overlook the obvious. Very minor changes can very quickly evolve into very big things. Methods of fluid output. Urine output measurement. Urine output is a crucial indicator of fluid balance in patients, helping healthcare providers monitor their hydration status. It is important to consider all intake and output. Urine, feces, vomit, wound drainage, perspiration, chest tubes, and drains. Accurate documentation is imperative. It affects our plan of care and how we take care of our patients. Nursing interventions. Encourage PO fluids unless on fluid restrictions. Make sure if you have a patient on fluid restrictions, you're letting your ancillary care team know that a patient's on fluid restrictions. Also, make sure your patient is aware that they're on fluid restrictions. Administer IV fluids, monitor fluid overload, document findings, communicate findings, especially changes. These small changes will happen. Don't forget to communicate them to each other, and especially if you have a new nurse coming on or you have other caregivers involved in the care of a patient, make sure you're communicating any kind of changes. All right. Everybody still with me?
Yes.
Okay, great. Understanding fluid volume deficit and excess. It's vital for effective patient care. Recognizing the causes and implementing appropriate interventions can prevent complications. Fluid volume deficit, FVD, fluid volume deficit, can occur due to inadequate intake, excessive loss from vomiting, diarrhea, diuretics. Identifying these causes allow for timely intervention. Think about people who go to concerts or are out in the heat. What happens? They're not drinking water, they're out in the heat. Maybe these people are on diuretics and they have syncopal events due to dehydration. It's important, so I will mention it again. Accurate assessment and documentation is of key importance. I'm just going to run through the slide quickly. Inadequate fluid intake, fluid volume deficit can result from not consuming enough fluids, leading to dehydration. Excessive fluid loss. Fluid can be lost excessively due to conditions such as vomiting, diarrhea, sweating, burns. Burns is a big one for fluid volume deficit. You can kind of tie those two together. And medications like diuretics. These can quickly deplete the body of fluids. Interventions. Encourage oral fluids, monitoring I&O, educate patients about fluid and electrolyte balance. Causes of fluid volume excess. Heart failure, these are big ones here. Renal failure, medications, and excessive fluid intake. Early identification and management are essential to prevent complications. Assessment and interventions for fluid volume excess. Assessment involves monitoring vital signs, weight changes, and fluid balance. Interventions may include fluid replacement and for deficits and diuretics for excess. Some of the symptoms that you're going to see are swelling or edema, bounding pulses, increase in weight, shortness of breath, abnormal lung sounds. Where you didn't hear crackles in the morning, you might hear crackles in the afternoon. Interventions, accurately assessing, continued monitoring, fluid volume replacement for deficits, and diuretics for excess. Electrolyte imbalances can significantly impact patient health. Understanding common imbalances, their causes, and appropriate interventions is crucial for nursing practice and passing your NCLEX. Common electrolyte imbalances, such as the sodium, potassium, and calcium, hyponatremia, hyperkalemia, and hypocalcemia. Sodium and potassium and calcium are key electrolytes. They play vital roles in bodily functions. Recognizing imbalances in these three can help provide appropriate nursing interventions. Let's take a look at each one more specifically. Hyponatremia, sodium is crucial for maintaining fluid function and muscle contractions in the body. Potassium is important for regular heart function and is essential for nerve conduction. And calcium is important for bone health, blood clotting, and muscle function in the human body. Now let's take a look at them individually. We're going to start with hyponatremia. This is another important slide. In fact, these next three, hyperkalemia, hyponatremia, and hypocalcemia, are very important. So I would say those are the three things you should really focus on when it comes to electrolyte imbalances. Hyponatremia is when a sodium falls below 135. The normal range is 135 to 145. One other thing I'd like to quick mention here is depending on where you work, sometimes the values will change just a little bit as far as what the norms are. So make sure wherever you're working, you know what your institution's normal values are. Symptoms of hyponatremia are nausea, vomiting, headaches, muscle cramps, confusion, and in severe cases, seizure, coma, and death. Causes: increased fluid intake, kidney failure, heart failure, cirrhosis, diuretics, other medications, and hormonal imbalance. What's our treatment or management? Fluid restriction, medication adjustment. Sometimes we're giving IV fluids, other medications to remove excess fluid, and treating an underlying condition. A lot of times there is an underlying condition as part of the situation. Some other interventions are to monitor vital signs closely and neurological status. Did somebody have a question or something? I heard something, I wasn't sure. Although I did not put this slide in green, I did put, I'm sorry, go ahead. Somebody have something to say? All right. I did put the title in green because it's important. All right, let's move on to hyperkalemia. Potassium, a normal range is 3.5 to 5. It is a level of 6.0 is considered dangerously high. Symptoms: mild hyperkalemia may be asymptomatic. However, in higher numbers, like around the 6 number, you'll see muscle weakness, paralysis, palpitations, nausea, vomiting, chest pain, diarrhea, and sometimes abdominal pain. Their EKG will also have changes. It will begin with tall T waves, short QT intervals in the early stage, loss of P waves, and prolonged PR intervals, with tachycardia and bradycardia in a moderate stage, and in severe cases, asystole and ventricular fibrillation or VFib. Causes: kidney disease and medications, very common. Kidney disease is a culprit for a lot of things, but hyperkalemia is one of the very common things. Treatment: medications like calcium, glucose, insulin, diuretics, and sometimes dialysis. Another key slide, make sure you recognize what hyperkalemia looks like. All right, hypocalcemia. It's in green. The normal range of calcium is 2.1 to 2.6. What kind of symptoms are you going to see in your patient? You're going to see numbness, you're going to see muscle spasms, you're going to see confusion, you might see seizures and tingling of the lips and fingers, which are called paresthesias. You might see fatigue, anxiety, and in extreme cases, cardiac arrest. EKG changes that you might see in hypocalcemia include bradycardia and some other arrhythmias like irregular heartbeats, prolonged, I can't read what's behind there, but prolonged, it's probably ST segment and QT interval, flat T waves, and prominent U waves. These are two classic symptoms. Shavstek's sign is the involuntary twitching of facial muscles when you tap on the facial nerve. The other classic sign is Trousseau's sign. It is a carpal spasm caused when you put the blood pressure cuff on and pump it up, you get a spasm in the carpal area. So These are classic symptoms. They go with hypocalcemia. Those are two things you're definitely going to want to walk away with today and associate them with hypocalcemia because you will see those again. Okay, some causes. Hypoparathyroidism is actually the most common cause of hypocalcemia, and the lack of vitamin D. What kind of treatment? Calcium and vitamin D supplements. Treat the underlying cause. How's everybody doing? Everybody doing okay?
Are you able to move your
Good.
picture up so we can see what is written under? Your picture is blocking.
How about that? Does that help you? Then I move all of you too, but if you guys are okay with that, maybe I can minimize it. There. Better? Thank you for letting me know that that was making it difficult for you to see. All right, so I think what you probably couldn't see here was prolonged ST segment, the facial nerve being tapped, the blood pressure cuff, we talked about that, vitamin D, and underlying condition. Okay, so how is everybody doing? Everybody doing okay? I would like to just mention here that when you're looking, there's so many things to remember in nursing, and there's so many things to remember when you're taking your test, that it's really important to just tie things that are abnormal or super common with whatever illness like hypocalcemia. You know, it gets tied with Schaafstek sign and Trousseau sign. They're classic symptoms. So trying to put those things together will help make it easier for you to identify them when you're either taking your NCLEX or you're taking care of patients. All right, that concludes the overview of fluid and electrolytes. How about we talk strategies to passing your NCLEX? Effective test-taking strategies are crucial for success on your NCLEX exam. Understanding prioritization, process of elimination techniques, and applying theoretical frameworks can significantly improve your performance. Is anyone using any other test-taking techniques? Are you applying the true and false method to questions? Feel free to send any other approaches that you're using in the chat, or if you are using the true and false method. I'm going to just take a second here and take a peek to see what we're... Yes, Maslow's. I actually talk about that. Thank you for bringing that up. Is it Tika? I hope I got that right. You're absolutely right. Keeping ABCs, you bet. Good job. Expected and a nursing process. That's a big one. I actually just briefly talk about that. There's no slide for nursing process, but those are all perfect. Very good job. You guys know what you're doing here. So let's go ahead and move on. All right, prioritization method. Understanding your ABCs, airway, breathing, and circulation, which are critical components for patient care prioritization, which make them important when you're taking your test. It's a very good strategy to use. Prioritization is identifying the most critical patient needs that ensures the healthcare professionals address life-threatening situations first. So a lot of times you're going to come across questions where they're all going to be right. Every option is going to be right. One of them is going to be the most right. And that's what they're looking for you to figure out. Which one is going to make the biggest difference in your patient's situation? Whether, for example, if it were shortness of breath, of the 5 options you can choose from, which one is going to directly impact that patient's shortness of breath for if that's the problem at hand? So walking through that in your mind when you're answering your questions is really helpful. I also want to mention that a lot of people apply the true and false method to questions. You can apply it to almost any question, but I just want to kind of caution you in that when you do the true and false method, and you're going to do that in addition to using these other strategies, make sure you know what exactly your question is asking, because sometimes they'll ask you a question and in my mind I'll automatically go, okay, they want to know what's what example of the patient statement is the proves that they understood the nursing education. So instantly you're going to pick the ones that are true, right? Well, what if they ask you, give me an example of the patient's statement that shows they need more discharge teaching? I don't know about you, but I know automatically I go to the trues and think, oh, that's the right answer, when actually they're asking you for something that's false. So I just want to throw that sense of caution out there to you. So if you are applying that true and false method in addition to your ABCs, your Maslow's, your nursing process, that you make sure you know what your question is answering. Okay, that's kind of my soapbox. I hate to see people make mistakes when it comes to using the true and false method, but it is very helpful. All right. Strategies to pass your NCLEX. Read the questions carefully and pace yourself. Taking the time to read your questions and answers thoroughly and twice if needed. I actually encourage that. Read your questions twice if you can. Practice with NCLEX style questions from Naxlex. Regular practice with NCLEX style questions can familiarize with the types of questions that you'll be faced with when you take your NCLEX. Identify common distractors in each question. Don't overthink it. Go with your gut, go with your first instinct. A lot of times your mind and your brain will get in your way when you start overthinking things. That's a lot of times what causes people to change answers and get them wrong. There it is in green. Do not change your answers unless you're certain you're changing it to the correct one. This is where I wanted to mention the nursing process. Nursing process is all about assessment. It's the one thing that we know is the most important thing we do before we can do any kind of intervention. We have to have an assessment. There's a lot of questions out there that you may run across in your NCLEX that are, the patient just came into the ER or just arrived at the ER and they have this, this, and this wrong. What intervention are you going to do? And of your 5 options, one of them will be an assessment. Odds are pretty good. The correct answer is the assessment part, because you can't provide an intervention unless you have a complete assessment. So this is one of those times you need to really make sure you know what your question is asking and you understand the setup of the question, kind of a distractor. The patient just arrived at the ER, or it's a patient who's been in the ER, in their room, or post-operative or what have you. So make sure you understand the questions. All right. So process of elimination. Process of elimination can significantly improve test-taking skills by focusing on plausible answers. The systematic approach to apply the true and false method to make eliminations, but by systematically eliminating any unlikely answers, you can improve the chances of selecting the correct answer. There's some answers in there that are absolutely not the correct answer, so you can just go right ahead and eliminate those right off the bat. These are called distractors. These distractors are options in your options of your choices that can they're unlikely things. They're things that don't belong. It's like, which one of these doesn't belong? It's kind of like that. So make sure you identify those distractors and help eliminate them right off the bat. It can make choosing the right answer a lot easier. Identifying common distractors. So distractors often include absolutes like always and never, which can mislead candidates into answering the questions. Similar answer choices and opposites. Similar answers, like when you see 2 answers that are very similar, potassium is high and hyperkalemia. Those would be an example of 2 answers that are similar. You can probably eliminate one of them. And then opposite answers. One is likely correct. Not always, not 100% of the time. Make sure you know what the question's asking you. But if you see hyperkalemia and hypokalemia, it's very likely that one of those 2 answers is the correct answer. Navigating tricky questions. Understand what the question is asking. Read it twice. All right, and here we are, Maslow's hierarchy of needs. The patient care framework. Maslow's hierarchy of needs serves as a vital framework for prioritizing patient care effectively, applicable in situations where more than one complex problem exists. Basic needs first, the physiologic, the ABCs, airway, breathing, circulation, then comes safety, then comes security, and then comes the psychosocial aspect. Let's see. I find this useful in the safety questions. Let's try a few questions using these strategies. Do we have any questions about strategies? Any additional things that we didn't cover? If you want to share, feel free. We do learn from each other. And as we go on to the questions, think about the strategies we just talked about and consider them as you choose your answers. I'm just going to take a peek at the chat, and then we're going to move on to some questions. True or false, mostly on select all. Yep, that's true. Acute versus chronic. It works well on select all that apply. I completely agree. Always start airway, do something first, or always start with airway, do something first. Stable and unstable. All right, very good. Boy, you guys are sure on task here. You're doing a great job. Stable versus unstable. Absolutely. All right, here we go. Everybody take a deep breath. I'm going to do the same thing. Uh-oh. Okay. What I want you to do is I'm going to go through the question and read it, and I would like you to go ahead and either put your microphone on and you can say it out loud, or you can send the answers in the chat, whichever you prefer. A nurse was taking blood pressure on the right hand of a client and noticed spasms of the carpal muscles. Which action should the nurse take first? A, check for paresthesia and numbness of the extremities. B, assess the other hand of the client. C, notify the healthcare provider immediately. Or D, apply a warm compress to the affected hand. This is a priority question. Let's take a look at the question here. The question is asking the nurse which action, so we're going to do an action or an intervention here, the nurse should take first, which means likely more than one of these is correct as far as what's important to do, but one of them is the most correct. What should we do first based on what we're seeing, which is carpal spasms or spasms of the carpal muscles? All right, let's see. I see answers coming in here. All right, good job, good job. I see a lot of the correct answers here, and not just because I have the answer in front of me. Great. So I'm going to give it a minute because I see there's a bunch more people coming in here with some answers. The actual answer to this question is A. So let's talk about why A is correct. Let's see here. Carlene, you got A, very good. Ruth, good job. All right. Somebody said something about a priority question. Yes. All right. So A is correct because we're going to check for paresthesia and numbness of the extremities. The nurse should first assess for other signs of hypokalemia as carpal spasms, Trosu's sign, the classic sign we talked about, can indicate this condition. Additional symptoms such as numbness, tingling, paresthesia, or muscle twitching help confirm the diagnosis. A thorough assessment is necessary before taking further action. Actually, we kind of have not only a priority question here, but the nursing process kind of kicked in with this one as well. Let's talk about why B, C, and D are incorrect. B is incorrect because assessing the other hand of the client, the nurse should first confirm the presence of other signs of hypokalemia before proceeding with further assessment. C, notify the healthcare provider immediately. Reporting to the provider is important, but only after confirming additional signs and symptoms of hypokalemia. D, apply a warm compress to the affected hand. Although this will provide comfort to your patient, it does not address the underlying cause of the muscle spasms. That is why D is correct. All right, you guys did really good on that question. Gonna check our chat here, see if there's anything. Yes, assessment. Good, good, good. Okay, there's a couple more. Hypocalcemia. Very good, Augusta. Excellent. Strong work, team. All right. We're going to move on. Number 2. Let's do these the same way, okay? A client is receiving a potassium chloride infusion. Which intervention is the most important for the nurse to implement? Which intervention is the most important for the nurse to implement? A, place the client on continuous cardiac monitoring. B, assess for signs of infiltration at the infusion site. Or C, monitor the infusion rate. Or D, monitor the radial pulse every 15 minutes. All right, tick tock, tick tock. Go ahead and take some time and answer that question. Let's see how we're doing here. Oops. Mumby, Marie, Emma, Kay. Boy, you all nailed this one. Holy smokes. Excellent job, guys. All right, A is the correct answer. So let's talk about why A is the correct answer here. A is the correct answer. Why do we place the patient on continuous cardiac monitoring? Because potassium plays a critical role in cardiac function. Good job. Abnormal levels can cause life-threatening arrhythmias. Do we remember the 6.0 is the number that can be dangerously high? Continuous cardiac monitoring is essential to detect early signs of hyperkalemia, such as peaked T waves, widened QRSs, and cardiac arrest. Let's talk about why B, C, and D are incorrect. I encourage you when you do these test-taking practice questions to always read the rationales because they can give you some insight into why exactly one is more right than the other when you're making choices. B, assess for signs of infiltration at the infusion site. Potassium chloride is a vesicant, and it can cause severe tissue necrosis if it eviscerates. While monitoring for infiltration is important, it is not the most critical intervention compared to continuous cardiac monitoring. And C, monitor the infusion rate. Potassium chloride must be infused at a controlled rate to prevent rapid increases in serum potassium levels, which can lead to cardiac arrhythmias. However, continuous cardiac monitoring is the highest priority. And then lastly, D, monitor the radial pulse every 15 minutes. While the pulse assessment is super important, potassium imbalances primarily affect the heart's electrical conduction, which is the best evaluated by continuous cardiac monitoring rather than periodic pulse checks. All right, you guys did fantastic on that one. Okay, number 3. A nurse is caring for a 45-year-old client admitted to the burn unit with severe burns. The adequacy of fluid volume replacement in the early post-burn period is best reflected by A, blood pressure, pulse rates, and daily weights, or B, quantity of urinary output and vital signs, or C, hemoglobin and hematocrit levels, or D, serum electrolyte levels and urinary output. I'm going to give you some time to answer the question here and go ahead and send them to me when you're ready, and we'll continue to go through them. I'm going to say this one is a little bit of a trick question. So make sure you're reading the question and you know what they're asking for. All right. Ooh, they're so quick. Good job, everybody. The actual answer for this question is B. I know that's kind of a surprise. We got a lot of D's, which I can understand why you would have chosen that. So I want to go through why this is important. So we have a patient with severe burns. We know that fluid volume is incredibly important in burn patients. They become hypovolemic very quickly in the early post-burn period. And this is a key word right here, early post-burn period. And when they say is best reflected by, most, you could replace that with most reflected by. So those are some key words. When I say read the question, it's really important to make sure you catch on to those, I hate to call them trick words. They're really key words, but early post-burn period and best or most reflected by. So B is the correct answer, quantity of urinary output and vital signs. Why is that one the correct answer? Well, it's the right answer because in the early post-burn post-burn period, easy for me to say, fluid resuscitation is crucial to maintain adequate perfusion. Urine output is what, a half a milliliter per kilogram an hour, which is about 30 milliliters per hour, is the best indicator for adequate renal perfusion and fluid balance. Vital signs, particularly blood pressure and heart rate, help assess hemodynamic stability and the effectiveness of fluid replacement. So why are A, C, and D incorrect? A, blood pressure, pulse rates, and daily weights. While blood pressure and pulse rate are extremely important indicators of circulatory status, they can be maintained temporarily through compensatory mechanisms. Daily weight changes do not provide immediate feedback, unfortunately, on fluid resuscitation adequacy. And C, hemoglobin and hematocrit levels, kind of the same thing. They may initially be elevated due to hemoconcentration because of the fluid loss, but they are not the best immediate indicators of adequate fluid resuscitation. And D, a lot of people chose D here, serum electrolyte levels and urinary output. While electrolyte levels are important to monitor for imbalances such as hyperkalemia and hyponatremia, they do not provide a direct measurement of fluid volume status. Does that make sense to everybody? All right. All right. So let's move on. Good. Thank you guys for answering. You did a really good job on that one. I can see where you might have picked D. It's just one of those instances where you kind of have to key on in on those words. Early post-burn period. All right, let's go to number 4 here. A nurse is assessing a post-operative client who underwent major abdominal surgery 48 hours ago. The client has tachycardia, hypotension, decreased urine output despite receiving IV fluids, and weight gain. Which of the following should the nurse suspect? All right. Gonna wait a couple more minutes here. We got more answers coming in. Keep it up. Okay, we're at number 4. And Selma, C is the correct answer. Good job. This is another one of those where I think it's really important to look at a couple of things in the question. So I don't think I went through the options here of septic shock, hypovolemic shock, third spacing of fluids, and acute kidney injury. So the nurse is assessing a post-operative client. Do you remember when I said something about third spacing is very common in post-operative patients? So the answer is C. It's third spacing of fluids. The thing about this question, though, which I feel like I'm inclined to point out, is that the patient underwent surgery 48 hours ago. Now the client has tachycardia, hypotension, and decreased output despite receiving IV fluids. So this patient is already being treated with IV fluids. And so if that were the case, if hypovolemic shock were the correct answer, the patient getting fluids, it would have improved the situation. The fact that it did not improve the situation should take you right to third spacing of fluids. So I'm going to go ahead and I'm going to read the rationales as to why these are correct, or why the one is correct and why the others are incorrect. So C is the correct answer, third spacing of fluids. Third spacing of fluids occurs when fluid shifts from the intravascular to the interstitial or third space, peritoneal cavity, bowel, or tissues, following major surgery, trauma, or inflammation. This results in hypotension, tachycardia, decreased urine output, and weight gain despite IV fluid administration, as the fluid is sequestered rather than circulating in the bloodstream. So that is why C is correct. And A, septic shock, is incorrect because it's associated with infection, fever, warm or flush skin, which is an early stage, and systemic vasodilation. This client has signs of fluid loss into the third space, but there's no mention of infection or fever in our question. So that's why I would not have picked that one. Hypovolemic shock. That was a very common chosen answer, and I can understand why people would choose this. Hypovolemic shock. While the client has hypotension and tachycardia, which are the signs of hypovolemia, they are receiving IV fluids without improvement. In true hypovolemic shock, fluids would be absorbed and improve the circulation, whereas in third spacing, fluid remains trapped in the tissues. Acute kidney injury could also cause decreased urine output, but is typically present or presents with rising serum creatinine or BUNs rather than in weight gain. The client's symptoms are more indicative of fluid sequestration rather than kidney dysfunction. Okay, does that make sense now that we kind of explained it? So the next time you would see a question like that, it would make more sense to you? Okay. All right, great. Good job, you guys. You guys are really on task here. You're keeping me on my toes. Keep up the good work. All right, should we keep going? Am I going too fast?
No,
Okay, great. Am I going too slow?
it's okay.
All right, perfect. Okay, number 5, here we go. A nurse is caring for a client with hypoparathyroidism. Which of the following meal selections would be the most appropriate? I know several of them look good, but what's the most appropriate for somebody with hypoparathyroidism? A, spinach and mozzarella. B, broccoli salad and cream cheese. C, stewed beef and corn. Or D, fried fish and french fries. Wow. You guys are nailing this one. Holy smokes. I'm super impressed here. Okay. So the answer is B, broccoli salad and cream cheese. As good as spinach and mozzarella sound, it is not a good choice. So why is B correct? B is correct because broccoli salad and cream cheese, both broccoli and cheese are good sources of calcium, which is crucial for managing hypoparathyroidism. Cream cheese provides a high amount of calcium and low phosphorus, while broccoli adds additional calcium and other important nutrients. A, why is spinach and mozzarella wrong? I love spinach and mozzarella on my pizza. Spinach contains oxalates, which can interfere with calcium absorption. Mozzarella is a good source of calcium, but oxalates in spinach counteract the benefits. C, stewed beef and corn. Although this meal provides protein and some nutrients, it does not offer a significant amount of calcium. Stewed beef is high in phosphorus, which should be limited in hypoparathyroidism diet. And then fried fish and fries. This option is low in calcium and high in fats. Fried foods are generally less beneficial for overall health. And the meal lacks calcium, which is necessary for individuals with hypoparathyroidism. All right, you guys totally nailed that one. Good job. I have to tell you a quick funny. So when I went to nursing school and we were doing our practice NCLEX stuff, we had an instructor tell us that if two things were in a test question, they're always right. Broccoli, if that was an option, that was always the right answer. And if hand washing was in the list, that was always the right answer. So I had a laugh when broccoli salad was the correct answer here. All right. Let's move on to the next one, number 6. A nurse is caring for a client whose EKG shows ST depression and inverted T waves. Which of the following electrolyte imbalances is the most likely cause? Hypomagnesemia, hypocalcemia, hypokalemia, or hyperkalemia? All right, I'll give you a little bit of time here. Excellent. Ferdinand, Dorothy, Guet, I don't know if I said that right, but good job. You guys are doing a great job here. Just waiting to see if there's any more coming in. All right, looks like they slowed down. Bree, good job. Okay, so the correct answer is C, hypokalemia. One thing I just want to point out about the question, I think I kind of forgot that in the last one, but make sure you know what it's asking for. It's the most likely cause. A lot of times more than one answer will be a cause, but one is the most likely cause. And You guys are correct, and it is hypokalemia. So hypokalemia causes ST depression and inverted T waves on an EKG. They're characteristic findings of hypokalemia. Low potassium levels affect cardiac repolarizations, leading to a flattened or an inverted T wave or ST depression and the presence of a U wave, which is a classic finding in hypokalemia, the U wave, the presence of a U wave. Severe hypokalemia increases the risk of life-threatening arrhythmias such as ventricular tachycardia or VTAC. Incorrect answers are A, B, and D. So hypomagnesemia may cause prolonged QT intervals and T wave flattening, but ST depression and inverted T waves are more typical of hypokalemia. B, hypocalcemia typically causes prolonged QT interval rather than an ST depression and an inverted T wave. And hyperkalemia is associated with a shortened QT interval and possible widened T waves rather than ST depression or T wave inversion. Right. Good job, everybody. All right. A nurse is assessing a client for signs and symptoms of fluid volume deficit. Which of the following clinical findings would be consistent with this condition? A, urine output of 3,500 milliliters a day, or B, weight gain, or C, widespread crackles, or D, orthostatic hypotension. I want you to tell me the answer, and I want you also to tell me what strategy you're using to answer the question when you send me a message in the chat here. See how we're doing. Process of elimination. Yep. Thank you, Carlene. Thank you, Sarah. Carrie. Yep. True versus false. Okay. Great. Bree. True versus false. Process of elimination. Good job. And it looks like everybody's nailing the question here. So, all right. So the answer to the question is D, orthostatic hypotension. Before I read the answers and rationales, we know it's D, but before I explain the rationales that go with it, I just want to point out a couple of things here in this question. The nurse is assessing a client for signs and symptoms of fluid volume deficit. Which of the following clinical findings, so key word here, clinical findings, would be consistent with this condition? When you're reading the question, make sure you look at what it is they're asking you for to make sure that that's what you're finding in your option bank here. So D, orthostatic hypotension, is the correct answer. And it is the correct answer because fluid volume deficit or hypovolemia leads to decreased circulating blood volume, which causes orthostatic hypotension, a drop in blood pressure when standing, dizziness, and potential syncope due to inadequate perfusion. The answers A, B, and C are incorrect. Urine output of 3,500 milliliters per day is polyuria. It is more common in fluid volume excess or conditions like diabetes insipidus or uncontrolled diabetes mellitus. In fluid deficit, the body conserves water, leading to oliguria or output less than 500 milliliters or cc's a day. And B, weight gain. Fluid retention leads to weight gain, whereas fluid volume deficit typically causes weight loss. C, widespread crackles. Pulmonary crackles or rales occur when excess fluid accumulates in the lungs, a sign of fluid overload. You will often see that in heart failure and kidney failure, but not in fluid deficit. All right, you guys are doing a really good job. How's everybody doing? And I agree, process of elimination was definitely what I would have chosen. And I do occasionally apply the true and false method when I answer questions, as long as I reread the question a couple of times and make sure that I know exactly what it is the question is asking me. So let's go ahead and move on to number 8. And I'd like you to do that again if you wouldn't mind. Tell me what strategy you're using to answer the question. This is one of those select all that apply questions. A nurse is providing teaching to a client who has been prescribed a low sodium diet. Which of the following foods should the client avoid? Select all that apply. So select all that apply tells us that there is likely more than one answer in this option bank. A, processed meats, B, whole grain bread, or C, leafy green vegetables, or D, canned soups, and E, pickles. All right, go ahead. Looks like somebody already picked an answer here. ADE, ADE, true or false? Okay, a lot of applying the true and false method. Think about foods that are salty. Very good, very good. Elimination process, true and false method. Anything that contains salt. All right, some people just pick things that contain sodium. That's an approach too. Okay. So number 8, the answer is A, D, and E. Some of my favorite foods is pickles anyway. A is processed meats and canned soups and pickles. So somebody already said it, anything with salt in it generally is not good for somebody on a low sodium diet. Even the low sodium canned soups still have a fair amount of sodium, although they're definitely a better choice than a regular can of soup. So A, D, and E. A is correct because processed meats like bacon, ham, sausage, and deli meats are high in sodium due to preservatives and the curing process. D, canned soups is also correct because they often contain excessive sodium as a preservative and flavor enhancer. Low sodium or homemade soups are definitely better alternatives. E, pickles. Pickles and sauerkraut are high in sodium due to the brining process. Just want to throw something out there. The brining process, a lot of times people will buy the chickens from like Costco's and Walmart's and the rotisserie chickens. A lot of them are brined. So something to think about when you are doing some patient education and you have people who are in like heart failure or low sodium diet or things like that. Make sure you let them know if you find out, remind them that those kinds of rotisserie chickens and meats that they buy at the store, although they look good and everybody thinks chicken is good for you, which it is, the problem is a lot of those places brine their chicken. So something to think about because they're soaked generally overnight in salty water. All right. Let's talk about whole grain bread and why that's not correct. Some breads contain added salt. Whole grain bread is generally a healthier option. However, checking labels for sodium content is advised. Leafy green vegetables, fresh leafy greens such as spinach, kale, and lettuce are naturally low in sodium and are a good choice for a low sodium diet. Okay, and take a peek at the chat here. Just wanted to be safe, wasn't sure. My glasses are fogging up here. All right. Processed and canned food, salt added, preservatives. Yep, good job here, guys. You are, guys and girls, you're all doing a great job. Select all that apply. Good work. Okay, let's go to number 9. A nurse is reviewing a client's record. The nurse determines that the client is at risk of developing a potassium level of 5.8. If select all that apply, means there's probably more than one answer in this bank of options. A, placed on furosemide or Lasix. B, diagnosed with Addison's disease. Or C, diagnosed with tumor lysis syndrome. D, ABG results show a pH of 7.3. E, has vomiting and diarrhea. I'm ahead of myself. All right, go ahead. Tell me what your answer is, your answers are, and then what strategy you use to come to your conclusion. This one is tricky. Somebody is correct. I'll give you a hint. There's 3 that are correct. So if you want to go ahead and change your answer, feel free. All right, so the correct answer is B, C, and D. Diagnosed with Addison's disease, diagnosed with tumor lysis syndrome, and D, ABG results show a pH of 7.30. I want to look at this, review this question with you a little bit. The nurse is reviewing the client's record, and the nurse determines that the client is at risk for developing a potassium level of 5.8 if. So what in this group here would potentially lead this patient to being hyperkalemic? Select all that apply. Whenever you see select all that apply, you can pretty much bank on the fact that there's more than one correct answer. So B is correct because a potassium level, you already know that, a potassium level of 5.8 is hyperkalemia. So B, diagnosed with Addison's disease. Addison disease causes adrenal insufficiency, leading to decreased aldosterone production. Aldosterone helps the kidneys excrete potassium, so low levels result in potassium retention or hyperkalemia. C, diagnosed with tumor lysis syndrome, occurs when cancer cells break down rapidly, releasing large amounts of potassium into the bloodstream, leading to hyperkalemia. And D, ABG results show a pH of, did I say BCD? BCD. ABG results show a pH of 7.30, indicates acidosis. In metabolic or respiratory acidosis, hydrogen ions move into the cells, forcing the potassium out into the bloodstream, causing hyperkalemia. So why are A and E incorrect? Placing somebody on furosemide, a loop diuretic, increases the potassium excretion, leading to hypokalemia, not hyperkalemia. And then E has vomiting and diarrhea. Severe diarrhea can cause potassium loss, leading to hypokalemia. And vomiting also contributes to alkalosis, which shifts potassium into the cells, further lowering the serum potassium. So that is why B, C, and D are correct, and A and E are incorrect. Did anybody share why they were, what strategy they were using? Yes, Lasix is wasting the potassium. Is it okay to just pick the answer you are sure of in a, absolutely. If you're sure of the answer, don't waste your time and move on to the next one. Only pick what you know and not what you don't know. That's right. Using the principles of ABGs, picking only the sure answer. Yep, that's all right. You guys are doing a good job. Knowledge on electrolytes. Like I said earlier, the three most important things are the hyponatremia, hyperkalemia, and hypocalcemia. Not that the others are not important, but those you're going to see a lot, and they're associated with a lot of different illnesses and diseases. So they are definitely going to show up not only in your NCLEX, but in your practice. So it's really important. If you can get a handle on those, you know, the rest will come to you as you practice. Okay. All right. Good work. Let's go to number 10. This is the last question. A nurse is caring for a client with sodium levels of 122. Which of the following interventions should the nurse take? Select all that apply. Key word here, asking about interventions. So you're going to want to look for interventions in your bank. Select all that apply means there's probably more than one answer that's correct. Implement seizure precautions. Encourage increased oral fluid intake. Monitor for changes in level of consciousness. Administer hypertonic saline as prescribed. And lastly, place the client in Trendelenburg position. Go ahead and pick an answer or more than one, and let me know what you're using for your strategies. Or if you're not using a strategy. I'm getting dry with all the talking I'm doing. No, somebody wanted to know the three electrolytes. I think, Sarah, is that what you wanted to know? Hyponatremia, hyperkalemia, and hypocalcemia. Those were the 3 electrolytes that we talked about where I said the titles were in green. So I think you can see these slides. Anything I put in green on my slides are things to remember. And again, those are just the basics. There's a lot of them that you need to know, but those are definitely the ones you're going to come across probably the most often, both on NCLEX and in your care of patients. They're associated with a lot of different illnesses. Too much potassium, uric acid is high. Okay, ACD, it's almost a band. That's right. Sarah said ACD for hyponatremia, think fluid overload and seizures. Somebody's using true and false, process of elimination. How can you access my notes and slides? They were on the website when you logged in or signed for the class. I'm not sure how long they stay up, but I know there's somebody can let us know in the chat. That'd be great. And we'll go through the answer. Process of elimination. Okay. How can I review the questions? I know that we are going to post the questions with their answers, the questions and the answers and the rationales so that you have them so you can reread them after we're done with this. And I believe they're going to put them, I don't know if they'll be up on the website forever, but we can certainly find that information out if one of my IT team is listening. Can you answer that question? Where can they access my slides? How long will they be available? And where can they access the questions, the answers, and the rationales? All right, while my IT team figures that out for us, let's go ahead and answer number 10. Okay, a nurse is caring for a client with sodium levels of 122. Which of the following interventions should the nurse take? Select all that apply, so there's probably more than one. A, implement seizure precautions. B, encourage oh, hang on. Hang on a second here, guys. My buttons are not working. Okay, sorry about that. I got a little touchy there. Implement seizure precautions, encourage increased oral fluid intake, monitor for changes in level of consciousness, administer hypertonic saline, and place the client in Trendelenburg. So the answers are A, implement seizure precautions, C, monitor for changes in level of consciousness, and D, administer hypertonic saline as prescribed. So why are A, C, and D correct? A sodium level of 122 is hyponatremic. Remember, the range is 135 to 145. A, implement seizure precautions. Severe hyponatremia can cause cerebral edema, leading to seizures. Precautions include padding the bed rails, ensuring oxygen is available, and keeping emergency medications ready. I have seen where nurses will bring crash carts outside of patient's room. You obviously have to check with your institution and make sure that that's something you can do if need be, but I have seen that done. C, monitor for changes in level of consciousness. Hyponatremia can cause confusion, lethargy, headache, and even coma due to the brain swelling. Neurological assessments should be frequent. D, administer hypertonic saline. 3% hypertonic saline is used in severe symptomatic hyponatremia of less than 120 or with neurological symptoms. It should be given slowly to prevent osmotic demyelination syndrome. B and E are both incorrect answers, and I want to share the rationale as to why they're incorrect. Encouraging increased oral fluid intake in dilutional hyponatremia, such as SIADH and heart failure, excess fluid intake further lowers sodium levels. Instead, fluid restriction is recommended. And placing a patient in Trendelenburg. Trendelenburg is mainly used for hypotension or shock. It could worsen cerebral edema in hyponatremia. All right. Before I move on, I just want to see if there's anything else in the chat. Thanks. Amy, good job. Notes will eventually be uploaded on the Naxlex QBank website. In case of any difficulties, you may reach the chat support assistant on the bottom left of the page. Did everybody get that? So you'll be able to access that information. I don't know if they're going to be a PDF, but you will be able to have them. For no fluids, yes, fluids for hypernatremia. Today is the first day to attend this session. Do you have it daily? No. We're actually this is the first one of fluids and electrolytes, and we're going to move through 8 different, actually there'll be multiple instructors doing 8 weeks of videos or webinars with different subjects, and you can access them on the website so you can see exactly what it is. I think the next one on Saturday is a critical care review. So, all right, just a couple of things here yet. Thank you for the comments. Thank you, everybody, for all of your hard work. You guys all did a fabulous job here. I just want you to keep a couple of things in mind here. Maintaining a positive mindset is really important. It can significantly enhance your exam performance by improving focus and reducing anxiety. Visualization is a powerful technique, and it does help some people with a positive mindset and imaging success. Imagine success in your exam. Some people do affirmations for confidence. That's certainly something that you can do to reinforce mindset, leading to better performance. Stress management. A lot of people get test anxiety. Stress management techniques are vital for maintaining mental clarity and focus during your exams. Final tips of encouragement here. Practice some self-care. Make sure you're doing some self-care routines into your schedule. I know everybody's busy. They're super important to reduce your stress. Time management. Create a structured daily plan that allows for breaks and revision. Seek support, like taking these classes and these webinars. Study with groups to enhance your learning. We do learn from each other a lot. Most importantly, though, believe in yourself. You got this far. Cultivate a positive mindset, believing in your abilities, and remaining committed to your study plan. We covered the importance of fluids, electrolyte balances, and NCLEX strategies. There's a light at the end of the tunnel. And I just want to remind you all of that as you prepare for your NCLEX. Maintain a positive mindset. It's crucial while you study and prepare. Effective strategies, practice, practice, practice. You've got this. There's a light at the end of the tunnel. Soon you'll all be starting your new nursing career. Thank you for your attention, your time, and your faith in us to get you through your NCLEX. I'll see you next time. Thank you, everybody. Notes will be, I don't know if everybody heard me when I said that earlier. Notes will
Thank
be.
you, Professor. Thank you so much.
You are very
Thank you.
welcome. Thank you so much. I hope this was helpful for you.
Yes.
It was very helpful. Thank you so much, and have a good evening.
You as well, and good luck. You guys are doing great.
Thank you so much.
You're welcome.
Thank you so much.
Thank you. You're all very welcome. You all made it here, so have faith in yourself. You will master this.
We will. Thank
Thank
you.
you. Thank you.
Thank you so much. Thank you.
You're welcome. I'll see you all next time, I hope.
Thank you.
Thank
We
you.
will.
See you
Thank you.
then.
Bye.
Thank you. Thank you.
Bye-bye.
How can we find the notes? It sounds like they're going to go ahead and post them here. Let's see. More webinars will come up. There is a lineup coming, live webinars. There's one tomorrow and the day after, same time. And the notes, I believe they're going to post. I got to find Ferdinand's. Notes will eventually be uploaded on the Naxlex QBank website. In case of any difficulties, you can reach the chat support assistant on the bottom left of the page. If you have any problems or questions and you can't find what you're looking for, please go ahead and post a question in that chat. They will help you and get you what you need. Does anybody have an exam coming up anytime soon? Oh, April. Awesome, James. Good luck to you. Keep practicing. You'll do fine.
Hi, do you meet daily for this session?
Pardon?
Do you meet daily for this session?
Do we meet daily for this particular session? It'll run.
Yeah.
No, this one will run every 8 weeks. If you look on the website, there's a list of all the webinars that are going to be available. They change by subject. So there's several of them a week. There's usually 6 a week, and they all have
Mhm.
different subjects. So I think in like 28 days, you'll hit a whole bunch of them. Or in 4 weeks, you'll hit like 24 or 28 of them.
Okay.
And then they'll start all over again.
Yeah.
Okay.
Yeah.
Okay.
I think when
Yeah, thank you.
I check the website on there is the NCLEX syllabus and there's also the live tutoring sessions. They are posted there and when they happen. For
Okay. Everybody hear that? They're gonna post live tutoring sessions as well. And remember, everybody taking your test. It's a hard test, and you can always take it again if you have to. Just keep practicing and have faith in yourself. You'll get there. There's a light at the end of the tunnel, I promise you.
Can I get access for the questions for practice?
Yes, they're going to put them on the website. So just keep checking the website. And they're going to put the questions, the answers, and then the rationales there for you. He didn't
Okay,
tell me
thanks.
exactly when they're going to upload them, but keep checking, check back, and they'll be there.
Okay, thanks.
You are very welcome. What is the best resource for study? I think it's different for everybody. I think the most important thing in studying for your NCLEX is practice, practice, practice. Make sure you're practicing questions that are similar to what you'll see on the NCLEX exam, much like what we went through. That will help you kind of prepare for what you're going to see when you take your test. It's also important to understand the strategies and some key concepts that go with the strategies. I think that was Kareen who asked. You're welcome, Douglas. And Bree mentioned in her chat, Naxlex has a variety of questions and rationales. My friends passed using it. Very good. You're a great group of students today. Any more questions? Everybody know where they can go to look for everything? Kareen, so you can go to the website, and if you can't find the questions in the slides, you can there's a chat box, you can put in there what you're looking for, and they will respond to you and get you whatever it is you're looking for. Then everybody see Ferdinand's answer. At the moment, it is a well-set exam to mirror the actual exam experience with a variety of questions and with various difficulty levels. And you just go to the Naxlex, Naxlex website, and you can access. There you go. Thank you for posting that. How do you know you are ready for exams? Oh, Kevin, that's a tough one. Practice, practice, practice. There's readiness assessment tests you can take after you do the practice, practice, practice to see how you're doing and how ready you are for taking your NCLEX exam. We do offer them too on our website. So if you want to go to the site, you can look for those. They're called readiness exams or readiness test exams, and they can help evaluate where you are at, and then you'll have a better idea to kind of gauge when you should try to schedule your test. I hope that answers your question. You're welcome, and good luck. I'm sure you'll do just fine. All right, any other questions? All right. Yeah, that's the key. Practice, 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 and just keep practicing. When you feel like you're ready and you're doing well on your readiness assessment tests, it's a personal choice, but I think when you're doing well on those, you can give it a shot. They do have practice exams as well, so you can always try that. All right, well, good luck to everybody.